Hi, welcome. I'm Nira Berry, life and happiness coach, and your host of Happy and Healthy, where we explore and discover all the many ways of keeping you feeling happy and healthy. And remember to stay tuned to the end for my Good to Know segment, where I've always got something good to share with you. So today we have a special guest, and we're going to learn all about different techniques and different procedures and how you can make yourself look good and what the latest trends are. So please welcome my guest today, Dr. David Berman. Thank you so much for being here. And you're the owner of Berman Cosmetic Surgery, and you are a board-certified plastic surgeon in the United States and in Canada.
Correct.
So that's amazing. That's really wonderful. And so I know that you know a lot about, different looks, and you really trained for many, many years to really help many people improve themselves. So what inspired you to get into this field?
It's kind of atypical. A lot of people assume, either my dad was a doctor, I've always wanted to be a doctor. I was actually terrified of doctors. I used to get allergy shots when I was a kid, and I was one of these brats that would start screaming as soon as I got off the elevator before I even got in the room. So I didn't have a very good feeling about doctors at all. But at the time in high school, my best friend was interested in medicine, and we started doing volunteer work in the emergency room. And I kind of realized pretty quickly that it didn't bother me. I thought I'd be like freaked out. And then I went to Stanford University, and I wasn't sure. I was trying to decide between medicine and business, and I wanted to do the same kind of thing, volunteer in the emergency room. So I called them up and said, I'd like to volunteer. And they said, are you a medical student? I said, no, I'm just first-year student. And they said, we can't go near the emergency room because of insurance laws. I said, well, how am I supposed to figure out if I want to be a doctor? And the person on the phone said, well, why don't you just call the doctor and let him hang out? So I actually did that. Stanford had a pretty well-known medical school, and I just basically got a phone book out, started calling somebody. Fortunately, I got somebody who was nice right at the beginning, and he said, it was actually two chief residents, and they just said, oh, anytime you're free, you want to skip classes, come down, we'll throw a white coat on you, and you can hang out with us.
You were really motivated.
Yeah, I was always driven.
From a young age,
Yeah, and I got interested and then decided to do medical school, and basically the rest is history from there.
How many years have you been practicing?
A long time. I finished medical school in '81, and then I did an internship. Then I did 5 years of general surgery, and then I did 2-year residency in plastic surgery and a fellowship in plastic. So I did 9 years after my MD, so it was a really long haul. When I trained, the better programs wanted you to finish a full general surgery residency. Now, I think it's also a lot more intelligent. They've really integrated the programs a lot more, so it's a little bit shorter.
Wow. Well, one thing that we should all know about you as well is back in the 1990s, you achieved fame when you reattached John Wayne Bobbitt's missing genital, his really famous missing genital. And so I just was wondering how did you become Mr. Bobbitt's surgeon to begin with?
Yeah, it was really serendipity. I just moved to the States. I was actually here on an education visa when I trained at UVA in Charlottesville.
From Canada.
Right, yeah, so I'm Canadian. That's why I had a Canadian plastics license as well. Did my training in the U.S., but I was here on an education visa. Went back to Canada, went back and practiced by myself or in private practice for 2 years in Toronto. And then I came back here in '92. And then shortly after that, it was in '93, my primary focus has always been Sterling, but at the time I had privileges at Prince William Hospital, which is in Manassas, and I actually wasn't on call that night, but I had done a lot of microsurgery, which is where you operate underneath the microscope, connect blood vessels and nerves and so on. So basically when John got attacked by his wife, they called me up, and at the time they called me, they didn't have the part. I said, should I still bother coming down? I said, I can't do much without the other part. And they said, oh no, don't worry, by the time you get there, we'll find it. She told them where she threw it, and true to form, when I got there, they had found it. And then
but how did they keep it?
Yeah, they put it on ice, and it can keep for a while, and it wasn't too far from the hospital. And it's funny, when I did the case, I just thought it'd be like an internal joke around the hospital. I didn't have a clue. It'd be basically worldwide. I mean, I got thousands of calls from around the world about it, and there were zillions of articles everywhere about it. But at the time, I just thought it'd just be like a little internal joke around the hospital, and that would be the end of it.
Right. Well, it's obviously it made
Yeah.
world news for a long time, and when you did that, that was like the first time you'd done that type of procedure, right?
Yeah, I had never seen anything like that before. A lot of people think I was the first person in the world to do that, and in all honesty, I wasn't. There weren't a ton of them done, but it had been done before. But this sort of took the world by storm, and I think what it was, obviously I did some research on this. The commonest cause, sadly, when somebody loses their penis like that, it's usually somebody with a lot of mental health issues, paranoid, schizophrenic, and a lot of times, so it's self-induced. And then by the time they sort of come to and realize that sometimes it's days later, and unfortunately it's too late then. And then I think at the time when I was reading, it was homosexual related. So it was pretty uncommon, especially in this country, to have it be spousal. So there was that whole issue. And I think for whatever reason, it really caught the world.
I think
it went way beyond the States.
People were fascinated by it. And
Yeah.
what would surprise us most to know about Mr. Bobbitt? Is there anything that you think is not generally out in the news that people have heard about?
Yeah, I mean, I don't want to get too caught up in the us or them, but, there are issues that bother me because, one of the things that people don't appreciate is they were living apart for a whole year before this whole thing happened. So there's a narrative that's very different that's being touted, and he'd been living apart for an entire year before this happened, and they were only together for a week. So, I got to know him fairly well during that time period, and then, of course, sort of went our own ways. And then it wasn't until a couple of years ago I reconnected with him again because there were a lot of, there was a cable show done about him, and the lady interviewing me said, "Oh, I just saw John yesterday." I said, "Wow, I haven't talked to him in like 22 years." So I connected to him. And so I know, again, he's not like a best friend, obviously, but
it's still functioning.
Oh yeah, it's
So
functioning.
you did a great job.
Yeah, I mean, I think most people know he ended up again, this wasn't with my advice, but he ended up doing a couple of porn films afterwards, about a year later.
Which only promoted your good work,
Yeah.
I guess.
Yeah.
So let me ask you, what are your most popular procedures that that you find that people want to maybe change about themselves?
Yeah, the thing I do the most of now is something called SmartLipo or laser lipo, and it's something I'm really, really enthusiastic. Almost 100% of people in our society, with rare exception, have fat somewhere on their body that they just wish would be less of or a lot less of. And the nice thing about SmartLipo is I can do it in the office under local anesthetic. I usually give people just a pill. There's no IVs because everybody's always a little nervous. And the nice thing about the incisions are only 2 to 3 millimeters, so they're almost invisible.
And is that really what most people want, is like to reduce to contour their body?
Yeah, for sure. I mean, obviously people want lots of things,
Yeah.
but that's one of the most popular things. I mean, almost all of us wish our body was a little more shapely. And I really like it because the risks are almost zero, nothing zero, because you're not being put to sleep like you traditionally do with liposuction, so you don't have the risk of general anesthesia, small risk of blood clots that you get with general anesthesia. Because you're awake, you're not going to get pulmonary emboli and DVTs.
I thought that it would be like breast augmentation or nose jobs that,
Yeah, those are all, I mean, I don't do noses anymore. All those things are popular just within my practice, partly because the equipment's specific and partly because I particularly like doing that, so I promote it. After SmartLipo, I'd say the next commonest thing would probably be breast augmentation and tummy tuck in terms of procedures. And then we have a lot of sophisticated lasers. In terms of just day-to-day stuff, I like to do my own Botox and fillers, so a lot of people delegate that to other people in their staff, but I actually like doing them. So, just in terms of sheer numbers, I do a lot more Botox than I do SmartLipo because, I can do 10 Botox in a day or more.
And when you do that, I guess you choose the procedures that you get the most reward from personally, or.
I would phrase it differently. I promote the stuff that I like most, but when the patient comes into me, it's directed on what bothers them. So, I think that's what's really important, and you learn it if you don't know it to begin with. It's important that, and I'll always ask them, what bothers you, because I may look at somebody and think, if they asked me, I would correct X. But if they think it's fine and Y bothers them, then it's much more important to address Y. And there's no reason to address X if it doesn't bother them. And that goes with really everything. With Botox, for example, the commonest area is between your eyes. Second commonest area is crow's feet. Third is forehead. But, I may talk to a woman and she may say, these lines don't bother me at all. These are the ones I want to
yeah.
fix. So even though I might notice it a lot more, if it doesn't bother her, and that's true of all of us. I mean, none of us are, quote, perfect.
Oh,
So
really?
yeah, yeah. So we all sort of pick and choose. And I always tell people too, with any of this stuff, there's no right and wrong. And I always tell people, you really want to think about, is this something that I want to put the effort and the money in? And if you're not sure, it's much better to wait.
Yeah. So if you you do all these things, and a lot of it's actually a multi-million-dollar business to do all these changes or Botox or whatever. Is it really all about beauty? What do you think about that?
I think a better way to phrase it's all about feeling better about yourself, and that's really the common pathway. And by the same token, it's really important to try and look at what's motivating the person. I'll give you two examples that I think were interesting. And fortunately, these are, in my practice, are very unusual. Most of the people I get, and I'm very lucky, they're very straightforward. They want to improve X, Y, or Z. If you give it to them, they're happy. But I'll give you two interesting examples. I had one woman come to me years ago and, came in ostensibly for a breast augmentation. I got talking to her, and it was pretty obvious pretty quickly. I said, you're pretty content with your breast size and shape. And she goes, yeah. And what it came out to is, unfortunately, her husband was having an affair with somebody with bigger breasts who was younger. And I said to her, if I did surgery on you, you're not going to be happy because your goal really is to get your husband back. And I said, if I do the surgery, you're not going to be happy. And I said, it's not right,
So there's a lot of different reasons why people do things.
And she recognized, the nice thing is she recognized it. And, I said, look you guys need counseling. You don't need surgery.
Yeah.
And I had another really interesting young woman. Most people, if you do their eyelids, come in because they have a little extra skin in their eyelids, and that's called an upper lid blepharoplasty. And again, it's something I can just do in the office in an hour under local. And it was a young woman, and most people are a little bit older, and said, I want to make my eyelids fatter. And I said, geez, that's really unusual. So I got talking to her, and I said to her after a couple minutes, I said, if you don't mind me saying it, I'm not a psychiatrist, I'm not a therapist, but there's a little bit of that in plastic. I said, you don't really like yourself. And if, again, same idea, if I do the surgery, you're still not going to like yourself. And it was actually really sad. I started crying, and I'd recommend
so you have
she
to
gets
be
in there.
like a part psychiatrist, I think, to
A
do
little
this
bit.
job.
Well, you
So
definitely,
that's what makes you so good. So hold that thought, and we're
sure.
going to take a quick break. You've been watching Happy and Healthy. I'm Nira Berry, your host, and stay tuned. We'll be right back. Hi, welcome back to Happy and Healthy. My name is Nira Berry, your host, and we're going to continue our discussion about plastic surgery and beauty and what different things we should know about it with Dr. David Berman. So, what are some changes that have happened through the years that you may have noticed that people have wanted to improve on themselves, or different procedures? Are there any new trends that you've noticed?
Yeah, for sure. The trends today are definitely towards minimally invasive or non-invasive, and a lot of it's technology driven. Just like our computers are getting better, the lasers are getting better. We can do an awful lot of great things, especially on the face with lasers, but also on the body with lasers. One of the machines I have is something called Sculpture, so it sends laser light through your skin and it melts the underlying fat and your body resorbs it. It's not going to be as aggressive as the SmartLipo, but it's, again, something you can do in 20 minutes, 25 minutes. You have to repeat it more than once, but it should improve most people. The laser I'm really excited about is a Picosure laser for your face. Almost 100% of women, unless they're really lucky, will have irregular pigmentation, dark areas, light areas on their face. And what they've traditionally do is CO2, Fraxels, IPLs. You get a lot of redness with those. And also, if you have any ethnicity, Asian, South American, Middle Eastern, anybody with color in their skin, those people are at very high risk for being worse rather than better because they hyperpigment rather than lightening, which is obviously a huge problem. And what makes the Picosure different is it fires 1,000 times faster, so there's little to no downtime, so you don't get the redness, and the risk of hyperpigmenting is a lot lower. Nothing zero, but it's much safer, and it's hugely popular in Asia. And it's a very expensive laser, but it's a really fantastic laser. So that's something I'm extremely excited about because it's really changing things. My own wife's done it for sun damage on her face, her neck, her chest, her hands. So again, you don't just think about your face. You can do it elsewhere on the body. And it's a really, really, really great laser that a lot of people don't know about.
So when you say sun damage, there's a lot of concern nowadays with people having any kinds of skin cancer, things like that. Does it help with that?
No, it's
or is
not.
It just
it's really more superficial.
Yeah.
So yeah, potentially there could be an improvement because it's lessening sun damage, but it's
Yeah.
definitely not recommending. And clearly, if somebody has suspicious lesions, they still need them biopsied.
Yeah.
So this is a completely different realm from that.
Yeah. So have you noticed a change as far as in the age group that's starting to have?
Yeah, definitely more. Well, definitely more younger people doing things sooner, but also just more people doing it because there's two things. One, it's socially, it's super acceptable. I mean, nobody has much qualms about it. And
I know, because you just told the world that your wife had this, your wife had that,
Yeah.
I was thinking, how is she going to react
No,
to that?
She's chill. And also just the fact that things are more minimally invasive. And it's a lot more affordable. So, you don't, again, way back in the day, it used to be for the rich and famous. Now, probably 30% of my patients are financing this, maybe 40%. So, it's very affordable for most people. And because we're also doing less invasive stuff, it tends to be less expensive than a full facelift or a full tummy tuck. Again, there's certainly a role for these traditional things, but there's a lot of people that would benefit from lesser treatments that are a lot easier, super fast recoveries, and less expensive.
Yeah, I think that if people, like you said, with that one procedure you mentioned, that there's no downtime. A lot of people don't have to take off of work. There's a lot of big improvements. Also, I think from, like, for instance, you've been doing this for years. So, like, the surgeons that are the board-certified surgeons are very accomplished, and it's not so much of an experimentation. It used to be,
for sure.
years ago, you could see if somebody had that, like those movie stars, you could see, like, oh, they just don't look the same,
That still goes on in Hollywood. And for my taste, I don't like it at all. It's kind of this mentality, if I would put maybe one syringe or two, they'll put 8 or 10. And I think a lot of people do not like that fake look. And it doesn't have, like, I have a lot of patients come and say, I don't want to look like so-and-so.
Yeah.
And that's really just a function of the plastic surgeon and the patient being on the same wavelength. If it's done properly, you should look like you and look natural.
That's, a lot of times, like, I'll see, let's say, a movie star or somebody on TV that you haven't seen for a long time, and then it's such a shock to see them, like, wow,
That's not great.
Yeah.
I think that's generally awful.
Yeah, like somebody should, put the brakes on.
Yeah.
So what are some of the things that people should consider before they, is there like any tips that you can offer?
The best thing, so some of the best advice I would say is, I think it's really important to go with a board-certified plastic surgeon. Just to take a stab at the term cosmetic surgeon, there is no board certification. Yeah,
no
sorry.
pun intended.
Yeah. So there's no true board cosmetic. It's really a title that you just give yourself. It doesn't exist. You have a gastroenterologist, a cardiologist, a general surgeon. Plastic surgery is a board. We pass certain exams. Cosmetic surgeon is just a title, so anybody can. They have to be an MD, but beyond that, it's free reign. So,
that's important.
Yeah, it's really misleading. So the first thing I would say is, when you ask somebody, ask them if they're board certified by a plastic surgeon, and they can look this up. On the board of plastic surgery, there'll be a list of everybody's credentialed. That's probably the most important. And then in terms of a personal, look at yourself and say, what am I trying to achieve? And if you're honest with yourself, you'll quickly realize, is it obtainable or not, or am I looking for something way beyond what I'm really looking at? And then I also try and stress with my patients, again, depends on the procedure. If they're having a breast augment, there's really no, they obviously have to cooperate, but when I refer to like SmartLipo, I always try and get people to use it as a catalyst to transform themselves. So if your diet's pretty lousy or not good, you're not exercising the way you should, a lot of times with my patients, when they do the SmartLipo, let's say, wow, I've invested this time, this money, and they start going to the gym 3 or 4 times a week, they start eating a lot healthier, that's transformative, and that'll change their whole life. So, look at, am I willing to make any effort about myself to enhance what the person's doing for me?
Yeah, I think that's a really good point. But so this should not just be one thing if they're going to change the contour of their body or whatever. That's like, as far as the face, there's only so much you can do, I imagine,
Yeah.
besides wear sunscreen,
Yeah, there's certain things you're limited, but even then, as much as possible, try and view it as a partnership. So again, if you go to a board-certified plastic surgeon, they'll have really good skincare products. They're all pharmaceutical grade. Things like that do make a difference with your skin. So again, even if you're just having filler or Botox, if you can get really good skincare that you're using at home, it'll make your skin shine, look a lot better. So you've got to view it as a partnership rather than I just go to him or her and they change what I want and then I'm done. So if you can view it as I should work with the person, you'll get, I think, a lot more advancement in what you're hoping to achieve.
That's a good point. And I think that goes along with a lot of other types of surgical procedures, such as gastro bypass. From what I understand, that if you don't keep up the good eating habits, that you can just expand the stomach again and start from square one. So it's, when I imagine if you recommend to somebody, if they get let's say the lipo or the whatever sculpting, that, you probably recommend for them to continue that healthy lifestyle. That makes sense. So what about, what makes a good candidate for,
a good candidate is, again, obviously it varies procedure, but the most important thing is obviously be realistic, What people often don't realize is liposuction is not a weight loss technique. Now, obviously, if your hips get a little smaller, you might lose a little bit, but it's not. Weight loss is basically largely diet-driven. Exercise less so, although I think they're both important. So it's important to be realistic, and also, really, regardless of the procedure, what you're hoping to achieve. And again, that should come out in the discussion. All my consults are free. And I'll tell them, what I think I can change, how I can change them, and, make sure that that's in line with what they want, because it's all about expectations. If the patient, if I do the best job in the world and the patient was expecting a little bit more, they'll be disappointed. And conversely, if I do, a good job, I was obviously trying to do a great job, but if it's a good job and she didn't think she was even going to look that good, then she'll be ecstatic. So it's important for the patient to look at what they hope to achieve and articulate that with the surgeon.
And what would be the most common, reaction or emotion that you come across with your patients?
Patients are thrilled. That's what's the fun part about the job.
Yeah.
It's a very visual job. Almost 100% of what we're doing is visual, and patients are really happy with what they can achieve, and they're ecstatic. And as we all know, if you feel better about yourself, that transforms other aspects of your life. Because if you feel good about yourself, you're going to be better with your partner and your kids and your other employees. And that's really the power of plastic surgery, is that, and I've seen this countless times, people change their wardrobe, change how they feel. And also that gives them the energy to now say, wow, I've done these changes in my face. Now I really want to go to the gym and start feeling healthier, get my body in better shape. So it feeds itself and it keeps carrying the momentum. And that's really the great part. If you can be a tool to help transform somebody and bring out the best, then that's really where the power is, much more so than the actual procedure itself.
Yeah, I imagine. And are there any other types of procedures we should know about that may not be advertised very often? Or
I guess the things I'd say about that, there's lots of procedures. Let me address something that is the other side of things, because I've been doing this a long time. Every year or two, there's some new procedure that's on one of the morning talk shows, and it gets a ton of hype.
Yeah.
And then like 2 years ago, nobody's ever heard of it.
So
I would
true.
So rather than address that, let me tell people when they see their show or they see this ad, because there's definitely things floating around that I'm pretty skeptical about. So I would say, by the same token, when you hear something new, if it's too good to be true, it probably is. That is true of everything in life. And then secondly, if something's really new, I would take a little bit of a step back and wait a little bit. It doesn't mean necessarily waiting even 5 years, maybe wait a year or two. And I think we're all getting wiser. Everything always has some great picture and some great personal testimony. And just because some lady or some man in some state somewhere suddenly did this doesn't mean it's going to apply very much to the rest of us. So I would say take a step back and then try and look at what the evidence is supporting whether this really is as great as it sounds.
Yeah, because it's so true. Like through the years, I've heard many things hyped up, and you think, oh my gosh, like this is the new thing, and you hear about that, and then like 2 years later, you just don't even hear about it anymore. Like, what happened to that? If it was so great, you're like, whatever happened to that? You know,
and that goes
I know that happens with many different things. So if people wanted to find out more information about you and get, maybe find out about your, your surgical center. So what would be the way they can reach you? Can you give us your website?
Yeah, the best way is my website. So it's Berman, Berman, cosmeticsurgery.com.
Okay.
And up there has all my procedures, got testimonials, lots of pictures, videos, blogs. That's really the best source. My consults are free, so obviously you have to make an appointment. They're free, and I'll spend, depending on what the topic is, anywhere from 15 minutes to up to 45 minutes discussing, and there's never any pressure.
So what would be like one pearl of wisdom that you could give our audience?
I guess probably, because a lot of people will go to various surgeons, and there's nothing wrong with that too. Go with who you connect with most. We're all price conscious, but certainly with surgery, I'm always surprised when people just go with whoever went lowest, and that's why you also get a lot of people going outside the country for their surgery.
Right,
and again, sometimes it works great. Obviously, there's lots of good surgeons in the world, but when you have a problem and you're out of this place you live, it's a real problem, and if it's out of the country, it's much, much worse. So,
well, that's really, really important point, and I thank you for bringing that up. But we've run out of time, and so I thank you so much for being here. And I think it's important for people to know what to expect and what's going on with this whole new frontier. That's well, it's not so new, but what's going on. So thank you so much, Dr. David Berman, and I'm Nira Berry, your host of Happy and Healthy. And stay tuned. We've got another segment coming up called Good to Know. So look forward to speaking with you. Hi, I'm Nira Berry, the happiness coach and your host of Happy and Healthy. And now it's time for What's Good to Know. And as part of my series on feeling good and looking good at work and in life, I'm going to speak to you about beauty from the inside and out. And it's really good to do what you can to make yourself look good on the outside if you feel up to it, and if it's all for the right reasons, whether or not it's through makeup or how you dress or even your car or your home. It's okay to do all those things if it makes you feel good. However, a real big component of happiness is how you feel about yourself inside. And to really bring that beauty inside, bring it inside to the outside. And how you can prove this is really just through how you react to things and how you make decisions. And I always recommend to my coaching clients to feel beautiful inside. I really say, stay true to yourself. And you may say, Nira, how do you do that? How do you stay true to yourself? And I say, you know what? It's just a matter if you really make those decisions based on if your life values and how you grew up with, if those things are important to you, if you stay true to them, when you make the decisions, you'll always have a happy day and a happy life. And it's really just a matter of really looking deep inside and being in touch with those feelings. So before you make any important decision or have an issue that you don't know which way to go with, take a step back, take a minute and take a deep breath, like literally take a deep breath. So, what I say is when you're thinking about it, slowly take an inhale in and exhale out and really notice how you feel. Like really notice how your gut feels when you're doing that and see if it really aligns with your values. And just pay attention to it. So do it right now. Think about some issue or decision you have to make. So let's do it together. So let's take a deep breath in and let it out. And so if you really do that as you're making your decisions, you'll see that when you go with the alignment of your values and feel how your gut reacts to things, you'll always make the right decision, and then you'll have a happier day. So thank you so much for watching, and I hope that you let me know how things go with you. I'm Nira, the Happiness Coach, and you can reach me at info@niraberry.com. And you've been watching Happy and Healthy. I'm Nira Berry, your host, and I hope you have a happy day.